Hello.
Good morning, sir.
Morning.
How are you doing, sir?
Yeah, I'm doing very well in Delhi now.
May I know your name, sir?
I am Dr. Shyam Prasad, consultant neurologist, Kollam, Kerala.
All the way from Kerala just to attend the awareness campaign that we are running here with the massive crowd that we have received.
Yeah, I think that's a good thing to start with.
Right.
Yeah.
So, I have a couple of questions to ask you. Now that epilepsy is one topic that almost everybody knows about it now. But there are still a lot of people who are not aware of it. So, we are just running this campaign for the people who are not aware of it to also know about it, since it's such a big topic to talk about. So, my first question is, for example, we have a patient who is suffering from epilepsy and he happens to get over it. He's recovered completely and he happens to get the same side effects or the symptoms of it couple of years back later, I mean. So what are the first things he's supposed to do?
No, first of all, epilepsy is a recurrent disorder. Even if you control with drugs, there is a 10 to 20% chance of a recurrence. And there are certain things one has to observe to prevent seizures. For example, you should have adequate sleep. He should not take any alcohol and drug abuse. He should not get involved in. And suppose he gets any infections with fever or things like that, he has to control it adequately, at the earliest. And he has to take care of his health. Provided these things are met, he may not get a seizure. And if he gets a seizure, probably he will need treatment again.
Okay. So you're saying, shall we consider it that way? If you have already recovered from the trauma of epilepsy, you can tend to have it again?
Yes, he can. There is a recurrence rate of about 10 to 20%.
Okay.
See, by giving a medicine to control epilepsy, we are only controlling the symptom. The basic pathology in the brain, we are not altering it. We are not treating the pathology in the brain. We are only taking care of the symptoms. So hopefully, we hope that actually our drugs will control the pathology, but it is not. It is only symptomatic treatment. The pathology may continue or may remain static, and he has a chance of getting the attacks again and again.
Right.
Yeah.
All right. So one more question I would want to understand. So for example, there is a student who is studying in a school and is currently in a school right now and gets an attack. He gets a fit. So what is the first thing his teachers or his colleagues, I mean his friends, his classmates are supposed to do?
During the episode of it?
Yes.
Yeah, there are standard norms are there actually. First of all, you should be permitted to, he or she, the student should be permitted to lie down quietly on the floor or on a comfortable bed. And he has to be turned on the left side so that any secretions coming from the mouth will naturally flow out. You should not collect in the mouth and cause difficulty to breathe. So you should be on the left side to loosen all the shirts and give him good fresh air. And epilepsy actually is a short event. If the convulsion will abate within about 1 to 2 minutes to ease off. If it continues for more than 5 minutes, he has to be taken to the hospital. If there is any other problem like injury or breathing difficulty continues, he remains unresponsive after 5 minutes, maybe he has to be taken to the hospital. Usually a single episode abates in about 2 minutes, 3 minutes, fine. And only thing is you have to take care of the child or the person to avoid any injuries during the episode. So let him lie quietly on the side, loosen the shirts, let him have fresh air, and don't put anything into the mouth during the seizure. Many people may try to put something into the mouth, maybe some liquid, maybe some objects, nothing. Let him lie down quietly and let it pass off. It passes off easily. Maybe 1 or 2 minutes, maybe maximum 3 minutes. If it continues for more than 5 minutes, he goes into the state of status and he has to be hospitalized.
I think that was very informative. Thank you so much for your information that you shared with us, sir. Thank you, sir.
Thank you very much.
Thank you so much, sir.